Hello there. I hope I didn't make you wait for too long. I rushed in as soon as the nurse called me. So, you made an appointment for a physical exam, is that correct? Okay, before we start, could you give me a second? I need to put my lunch on my table here. Okay. So, why don't we start with your personal information? I'm going to collect your information, so we're going to start with your general information. So, can you tell me your names? And your age? Okay. And do you have any complaints or concerns about your health condition? Okay. Oh, really? Interesting. Okay, I'm going to ask you some questions regarding your lifestyle behavior. So, do you smoke? Fair enough. Good. And do you excessively drink alcohol? Next question is, are you on a diet? That's a new one. Pretty unusual. And do you exercise? Cool. How many times a week? Good, very good. Okay. Now, some questions regarding your family history. So, do you have any family history of any problems from the male side or the female side of the family? Oh, the male side? Your father has a dry scalp and a dandruff problem. Okay, I understand. And you think you have that problem too? Yeah. Well, let's check it out for you. Okay, and have you had any booster shots recently? Okay, so cool. All right, that's gonna be with the questions for now. So let's start with your examination. Put some gloves. You didn't mention if you're allergic to latex, since my gloves are latex ones. Okay, very good. Alright. First thing I'm going to do is I'm going to check your vital signs. First, I'm going to start with your blood pressure. So, I'm going to put this like that here. And I just want you to relax. Okay. Okay, let me just see if I can. Okay. Okay. Okay, now just relax. Okay. Yeah, I'm just gonna check without the stethoscope now and see if it's necessary to check with one after I see. Okay, I think it's stable at yeah, it's on normal level. Yeah, I don't think it's necessary to use the stethoscope for another check, so you're good. right. So just take that down. Okay, next on the list, I'm going to check your heart rate, or I'm going to do a quick heart examination just to check the health and condition of your heart. And then I'm going to check your respiration rate, check your breathing. So I'm going to perform a lung examination after the heart one. And last but not least, it's the temperature one. I'm going to check your temperature. So for this task, I'm going to use the stethoscope to check your heart, okay? So I just want you to relax and breathe normally for me, okay? All right. Breathe in, breathe out. Yeah, just normally. Don't worry. Wait. I think I heard something. Wait. No, it's nothing. Okay. So far, so good. Now, let's see what's next on the list. Do we have... Oh, yes, the respiration rate, of course. Just to check for any crackles or wheezes or decreased breathing sounds. Breathing, yeah. Okay, so I just want you to follow my instructions and breathe in and breathe out. Good. And again, breathe in and breathe out. One more time at the chest. Breathe in and breathe out. Okay. Now I'm just going to have a listen of your back. Breathe in and breathe out. Okay. Now from the other side here. Breathe in and breathe out. Okay. Now last but not least, I just want you to breathe normally for me. Okay. Your lungs are healthy so far. I just want you to breathe in and hold it, hold it, hold it, hold it, and out. Doing good. So far, so good. Let me just take that down. Now I'm just gonna check your temperature. Okay, now I just want you to open your mouth for me. Okay, say ah, like that. Okay. Very good. Okay, very good. Yes. Perfect. Okay, I think that's enough. 36.8. Yeah, pretty normal to me. Sounds great. Let's stick that down. Okay, now for the next step, I'm going to test your general appearance. But before we start, we're going to I'm going to perform a memory test on you. So I just want you to remember those 3 words: tiger, Savannah, and Mercedes. I want you to remember them. I'm going to ask you about them in a couple of minutes, okay? So, what do I mean by a general appearance? So I'm just going to gather some information by watching and talking to you, okay? Great. Okay, so let's start. Hello there, nice to meet you. What is your name? Good. And how old are you? Good. And are you in high school now? Okay. What are your hobbies? Great. Okay. So I'm going to take some 2 steps behind. Is there any distortion? Do I look blurry? Okay. And how are you feeling right now? Okay, okay. And what is the date today? Yeah. Okay, okay. Yeah, I'm not noticing any stuttering, which is great. Okay, and now back to the memory test. Can you tell me those 3 words you were supposed to remember? And one more? Great, yes, no doubt, yeah. Tiger, Savannah, and Mercedes, great. So, we're done with the vital signs examination. We're done with the general appearance one. Next is the head and neck exam. So, first, I just want to check your scalp to see if you really have any dandruff, even though I'm noticing some particles here. So, I'm going to get up close to you, I hope you don't mind, and have a look of your scalp, okay? Okay. Alright. Yep, I definitely see quite the dandruff here. Now the terminal area, aka the back of your head. Okay, now let me have a look of this side here. All right. I'm just having a quick look of your hair follicles, your hair, your scalp, down the top here. Okay, so yeah, your scalp is very dry and you're experiencing itchiness, like right now. And yeah, also about the dandruff problem. What kind of hair care products do you use? Yeah, I'm aware of this one. I think it has too many chemicals in it. So I think this may be the reason for you to have such an itchy and dry scalp with dandruff problem. Well, what I would recommend is to use shampoos or overall hair care products which contain natural products, natural ingredients. They're much more gentle to the scalp, to your hair, as they don't contain too many chemicals. Okay. Okay. Let's see what's next on the list. Okay. I'm gonna have a quick look of your teeth, your gums, your throat overall. Let's see. Okay. Okay, just open your mouth again. Say ah. Yep. Okay, that is unusual. You don't have your tonsils removed. Normally, the patients who come here have their tonsils removed. Okay, let me check your teeth to see. Do you floss? Okay. Alright. Yep, your gums here. Yep. Your, yes, pretty good oral hygiene. Yeah, for sure. You're keeping such a good oral hygiene. Okay, your throat, see. Have you experienced any sore throat lately? Okay. Yeah, this is pretty common. I just wanted to ask. Well, I do not recommend you to drink cold alcoholic beverages since they, how to say, badly affect your throat, causing it to be sore. Okay. Now, I'm just gonna have a feel of your chin and your neck to see if there are any lumps or bumps. That's excellent. Okay. Yeah, you're doing very good. Alright, good. Now, I'm going to have a quick look of your nose, of your nostrils, so that you'll head up and look at this nostril here. Okay. Okay. No stuffy nose? No, not at all. And then let me have a look of your ears, a quick look. I'm not an expert when it comes to ear, throat, and nose, but I can perform a general checkup just to determine if there are any problems. Now the other ear. Okay. Yep. Have you ever had any build-up wax? No? Okay, yeah. You're definitely cleaning your ears. And what do you use to clean your ears? Fair enough. Next is involving me using the stethoscope once again. So, next step is abdominal examination. So, I'm going to listen to your stomach, to listen to your bowels, to check for any problems. Okay. Bowels sound good enough. Pretty normal. Okay. All right. I'm just gonna tap in your abdomen, so I just want you to relax. Does it hurt? How about here? Yeah, it tickles a little bit, sorry. And again? Does it hurt? Any pain? Any discomfort? Okay, that's great. Remove this. Okay, I'm gonna take that down. Okay, we have the neurological exam next. So, I'm going to test your motor functions just to check the reaction of your muscles to the hits I'm going to apply. So I just want you to relax. I'm gonna hit specific spots of your arms, legs, kneecaps, etc. Okay, now just relax. Okay, response is great. Here as well. And now the palm. And here. And again here. Okay, now your legs. Just relax. And here. Okay, now your kneecaps. Does it hurt? Okay. Yeah, no weaknesses found for sure. No, I don't notice any weaknesses. And last but not least here. Okay. Well, I didn't find any weaknesses in your muscles, so you're doing great. Next thing I'm going to do, I'm going to test your balance. So if you could just your hands like that, yeah. Spread them like that. I'm just gonna put a bit of paper. So just relax, yeah, like that. Okay, great, good. Balance is great. Okay. Okay, yeah. Don't worry. Alright, let's see. I just check that down. Now I just want you to grip my hands like this. Okay, now palms up. Okay, yeah. Now we can just palms down. Thank you. Okay, now I'm just gonna check your fingernails. Okay. You know, a little bit yellowish fingernails indicate when a person smokes. This is one of the common symptoms when you're smoking, or so to say, side effects. Just have a look like that, just make sure that everything is okay. Okay, next I'm going to check your skin. Yep, roll up your sleeves. Oh, that's interesting. And again, roll up your sleeves. Okay. A very clean skin. No problems found, no signs of problems. Let me just have a quick look of your face. I'm not gonna touch it. I'm not qualified as a dermatologist, so just specialize in physical examinations. So maybe I just okay. Let me check your forehead. Okay. I have a question. I'm quite impressed how clean your skin is. What do you use to keep your skin in such a condition? You're drinking aloe vera. That is a huge plus for the skin. And for how long? Nice. Patient's drinking aloe vera. And you use it as a cream? That too? Even better. Yeah, it's very good for your skin. It's a huge plus. Okay, so from what I've written so far on this paper here, is that first of all, you complain from anxiety. Well, what I would recommend for this is to avoid staying at home for too long. Try to go outside as much as possible, with or without friends. Just go outside, enjoy the nature, walk at the park, as long as you do not stay at home for too long, because the more you stay, the worse the anxiety gets. Okay, about your lifestyle. You do not smoke, which is great. You rarely drink alcohol, which is also great. You're not on a diet. You used to exercise. I recommend you continue exercising. Okay, I checked your vital signs. Your blood pressure is normal, as well as your heart rate. Your respiration rate is normal, as the normal levels are from 12 up to 16 breaths per minute. Your level is 14 breaths per 1 minute, which is in the normal. 20 plus per 1 minute indicates a heart or lung problems, which you don't have, so you have nothing to worry about. We checked your general appearance. Now the scalp. Like I mentioned before, try to use hair care products which contain natural ingredients, and try to avoid using products which contain too many chemicals, because those chemicals badly affect your scalp. Okay, I do hope you understand. Okay, check your teeth, your gums, your throat, your tonsils, ear, nose, and neck. I'm not qualified as an ear, nose, and throat doctor, so if you experience any problems with your ears or nose or throat, or you want to have an in-depth look, you can contact an ear, nose, and throat doctor. We have one. It's right above me. You can always contact them to ask them for consultation. Okay. Next is, I checked your neck for any lumps or bumps. I didn't find. About the abdominal examination, your abdomen seems to be functioning normal. Your bowels sounded pretty normal to me. So about the neurological exam, I tested your motor functions, and your muscles didn't indicate any weaknesses or any signs of problems. I tested your balance as well, and it's pretty great. Okay, so I checked your fingernails, I checked your skin. For that, I recommend you to keep drinking aloe vera, because it positively affects your skin. Your skin is very clean. So I recommend you to keep drinking it and keep using it as a cream. Okay. So yeah, that's pretty much about the conclusion. Do you want the results emailed to you? Okay, can you show me your email? And your phone number, just in case. Okay. All right. So that's pretty much about the examination. Like I said, overall, you're doing perfect. You're doing great. You have nothing to worry about. And I wish you a great day. Goodbye.